in. Hello.
Hello.
Hello, Nico.
Hi.
How are you today?
I'm pretty okay, thank you.
Okay. So, to our viewers, Nico came to us from the Netherlands.
Yes, correct. From the south of Holland.
From the south of Holland.
Yes.
Okay. And why did you come to us?
I come to you because I was looking for a well-established, a very well-known company who could do the ablation. I had already for a long time the ablation, and I was looking for a good service.
Okay.
So, and I was looking around. I entered in internet who is the best internet clinic in Europe, and your name came above.
Okay.
So I contacted you and started to ask some questions, what's going on and everything else. And I decided to come over here.
Okay. So you've been suffering of atrial fibrillation.
Yes.
For how long?
For 20 years.
For 20 years.
Yes.
Okay. And what medications were you taking?
None whatsoever.
None whatsoever.
No, until I had a stroke last year, and then I got some on the blood thinners.
Yeah. So 20% of patients, as a first diagnostic, or the first thing which appears, is a stroke, which happens. And then further research shows the patients have AFib, and then they give blood thinners. So with the blood thinner, you're actually protected. Yeah. However, you still had the symptoms.
Yes, that's correct.
And when did the doctors in the Netherlands tell you you needed an ablation?
That was already a number of years ago, but I didn't want to do it yet at the moment because I thought it's not the system or the technique which I'm looking for. Okay. So I heard about this new technique, but they just came on board. Yeah. So that's why I had to still wait a few years, and now it is everybody's using it. You're using it. Yeah. And that's helped, and that made my decision.
Okay. So this is a PFA. Yeah. PFA is a pulsed field ablation.
Yes.
This is a new technique which is used. It's an ablation technique where, with a catheter through the groin, we do a pulmonary vein isolation on the lung veins. And the energy source is cardioselective, which means only the heart muscle is ablated. Yeah. And the scar is created there. There's much less complications, and the procedure is very fast.
Yes.
Yesterday, I think took us 30 minutes to do the 3 isolations of your 4 pulmonary veins. Yes. Because the left had a single ostium. Yeah. So that you came to us, and tell us, how did it go? First, the contact over, I think, was the WhatsApp chat on our homepage.
Yes, correct.
Then you were in touch with Nancy, who is our international patient officer.
Yes, she started to organize everything, so we agreed on a date. We came over here day before yesterday. Yeah. You did a checkup in the afternoon. Yeah. And then yesterday I came here, and it went very well. But what I noticed is you unburden the patient. That's how I call it. Everything is taken away from you. You just go into the system, and everything was very good. Okay. I went into the operation room, and I came back. I woke up and had to stay, of course, lie flat on my back for a couple of hours. But it was, I wouldn't say great because it's still an operation, but it was good. Okay. It was good.
And so after the procedure yesterday, you spent the night in the hotel?
Yes.
You had, obviously, our cell phone number.
Yes.
In case of any problem.
Correct.
And now you just came for a control, and everything's fine.
Everything is fine. Everything's done.
And tomorrow you're flying back?
Yes, tomorrow we're flying back. Okay. So it was very quick, very perfect. So that's what I wanted. And I'm very happy with it. Okay. So thank you very much.
So let's hope the result lasts.
Yes.
And that you're free of AFib as long as possible.
Yes.
And we wish you all the best.
Thank you very much. I wish you all the best as well.
Thanks.
Thank you.
Bye.
Bye. Thank you.
Perfect. That's it.
Happy?
I think so.
Good.